Good morning, everybody. Good morning. I'm pleased to be here today to mark the opening of the Clinical Triage and Stabilization Center at Provident Hospital. I want to thank Commissioner Bill Lowry, Vice Chair of the Cook County Health Board of Directors and Chair of our Cook County Health and Hospitals Committee, as well as Commissioner Alma Anaya, who's Vice Chair of Health and Hospitals Committee, for their leadership and support. I also want to recognize key members of the Cook County Health team whose efforts made this possible. Dr. Eric Makaitis, CEO of Cook County Health. Dr. Tom Nutter, Chief Behavioral Health Officer. Dr. Carlos Caseda Gomez, Senior Behavioral Health Officer. And I want to thank also Elizabeth Granado, who's our Bureau Chief for Asset Management. And a special thank you to Elder Lanyard Smith of the Apostolic Church of God for sharing insights on what this unit means for the South Side. Thank you, Elder. Thank you all for being here and for your support. We know the need for mental health care is urgent. 1 in 5 adults in the United States experienced mental illness in 2021. At the same time, nearly 8% of the population faced both a substance abuse disorder and a mental illness. Yet on average, it takes 11 years for a person to receive treatment after their symptoms first appear. This is unacceptable. This unit is an essential step to closing that gap. It offers a direct entry point to care. It will connect patients to the services they need while reducing the reliance on emergency rooms and the justice system to address the mental health crisis. Just as important, this unit creates a welcoming space, helping to break down the stigma around seeking care and making it easier for people to get the help they need. When we invest in behavioral health, we build safer, healthier communities. And I applaud Cook County Health for leading the way in this work and for ensuring that more residents have access to the care that they deserve. Thank you all. Now, I'd like to bring up Commissioner Bill Lowry, who is my commissioner, and Vice Chair of the Board of the Health and Hospital Systems and Chair of our Health and Hospital Systems on the Cook County Board. And I would ask each person who speaks to introduce the person who follows them. Thank you so much.
Thank you. So let me say thank you to our president, Tony Preckwinkle, and a belated happy birthday to you.
Thank you.
And while we're applauding, let's applaud again for this beautiful new unit here at Provident Hospital. I am Bill Lowry. I serve as Cook County Commissioner of the 3rd District. Welcome to the 3rd District. I come before you today honored to serve as the recently appointed Chair of the Cook County Health and Hospitals Committee and Vice Chair of the Cook County Board of Directors. I know I saw at least one other director here, Joseph Harrington, so I want to acknowledge his good work too. He certainly is here somewhere. I think he's hiding. But I want to just say the importance of my role is not lost on me as I continue to focus on the provision of both traditional and behavioral health care here in the 3rd District and beyond. You know, over the course of my 6+ years as commissioner, I've seen Provident truly impact lives. And when I say Provident is a gem of the 3rd District, I mean those words. During the time that I've been able to serve in this capacity, I've seen a new dialysis center here. During the time that I've served as commissioner, we've seen a resumption of ambulance service here at Provident. We've seen a new MRI center, and the importance of that cannot be overstated. MRIs are used to confirm diagnosis and rule other diagnosis out. It was an MRI that showed that I had early stage cancer, and it's because of that MRI that I'm able to stand here before you today. And I've seen Provident Scholarship Fund impact the lives of students in the disinvested communities of Cook County who are seeking careers in healthcare. And over the past 3 years, this effort has resourced our youth, our community, to the tune of $2.3 million. But we need today to rejoice that we're cutting the ribbon on the new clinical triage stabilization unit here at Provident. You know, behavioral health care is just as impactful as traditional health care. And why is it so needed? It's needed because during the Rauner years, 80,000 Illinoisans lost their mental health care coverage. It's needed because in 2012, 6 of our 12 mental health facilities were closed by the city of Chicago. And it's needed because as I speak to you today, 49% of the individuals who are being detained in Cook County Jail have been determined to have a mental health concern. It is our responsibility to make sure that mental health care, behavioral health care is available not just within the walls of Cook County Jail, but in all the communities of Cook County. That is why today is so important. This unit today will just underscore what we at CCH know, and that is health care is for all. It is a right of all. It is not a privilege for the few. So thanks for being here. Make sure all of our neighbors know that we're now here and ready to provide this type of health care. So it is now my pleasure to bring up my dear friend and Vice Chair of Health and Hospitals, Commissioner Alma Anaya.
Good morning, everyone. I am extremely excited to be here with you all today. My name is Alma Anaya. I'm Cook County Commissioner of the 7th District. The 7th District is the southwest side of the city of Chicago. Communities that are primarily Latino, immigrant, Spanish-speaking. And I was just talking to someone about the importance of today for all of the communities of the south and southwest side of the city of Chicago. And yes, I do serve as the vice chair of the Health and Hospitals Committee at the county and the committee. But ultimately, I serve as a representative to really bridge that gap between my residents and the people I represent and services like today. And that's what we're really celebrating today, because this triage that we're doing this wonderful ribbon cutting for represents a lifeline for so many individuals and their families. Let's not, forget that in reality, when a person is experiencing something through behavioral health or a crisis of some sort, that the family, that the community is impacted. And let's also not forget the layers of oppression that is caused because of poverty and not being able to connect, the access to health care, the lack of a person, if not treated, not being able to have or hold down a job or not being able to pay their rent, and what that really causes. And that domino effect is so important for us to really look at through that lens, because in reality, here in Cook County, being one of the biggest safety, if not the biggest safety net in the Midwest, for us to be taking an additional step around, behavioral health and having this triage center is one step additional that we're taking, because we've already invested so much more in the partnerships that we're having regarding the organizations that are going to be doing impact on the ground. And like, Chairman Laurie mentioned, it's important that we're going out and we're doing that, but it's even more important for folks to understand that they can come to us and that there's a space that has caring individuals, passionate individuals, and helping get a person treatment. And that's why I want to make sure that we're celebrating that today and celebrating each and every one of you individuals that created this opportunity, that put all of your heart and soul in getting it to this place, but you'll be continuing to put your heart and soul in ensuring that that service is getting to every person that comes to us. So thank you for making that commitment. Hola, buenos días, me llamo Alma Anaya, soy la comisionada del 7º Distrito del Condado de Cook. Yo represento el suroeste de la ciudad de Chicago y hoy estamos celebrando algo muy bonito, que viene siendo el abrimiento de esta clínica que va a ayudar a muchas personas que están teniendo problemas de salud mental. Nuestras comunidades por muchos años han necesitado este tipo de servicio y no han habido un lugar donde se pueda acudir. Y ahora, teniendo este lugar aquí, estamos dando una señal que hay esperanza, una señal que podemos hacer y podemos ayudar a las personas que acuden a nosotros, pero también es un compromiso que estamos teniendo como el sistema del condado para tener este servicio disponible a las personas que acuden a nosotros. So, muchas gracias a todos los que han hecho este momento posible, y yo sé que con esta pasión que tienen y este amor que hacen esta labor van a continuar ayudando a muchísimas personas en el sur y suroeste de la ciudad de Chicago y del condado. Gracias. And without further ado, I'd like to introduce our CEO, Dr. Eric Makaitis.
Well, good morning, everyone. Good morning. Thank you all so much for joining us here today as we cut the ribbon on Providence Clinical Triage and Stabilization Center. This is another way that Cook County Health is committed to health access and providing the care that people need. I'd like to thank President Preckwinkle and Commissioners Lowry and Anaya for being here today with us, and the entire Cook County Board of Commissioners for their support of the work the health system is doing. I'd also like to thank the Cook County Health Board of Directors for their leadership and guidance, including Director Harrington and past board member Inger Burnett-Ziegler, who's our newly appointed Chief Behavioral Health Officer for the state of Illinois. Thank you as well to our behavioral health team for their tireless work putting together this unique space, particularly Drs. Nutter, Quezada Gomez, Miller, and Khan. I'm grateful to the Cook County Bureau of Asset Management as well for their great work on this project. It's truly been a team effort. I'd also like to thank Elder Smith from the Apostolic Church of God. He's a member of our Provident Advisory Council and will be speaking about the importance of this center in just a few minutes. Cook County has invested nearly $4 million to build out this space that will provide immediate mental health care services starting next week. Approximately half of this funding came through the American Rescue Plan Act, ARPA, allocated to our health system by Cook County government. The Provident Hospital Clinical Triage and Stabilization Center is designed to provide compassionate expert care for individuals experiencing a mental health crisis without requiring inpatient hospitalization. Our goal is to create a calming and supportive environment where patients receive immediate stabilization, short-term treatment, and a personalized care plan going forward. We know the need is great and that it's important to provide entry points to care that are easily accessible for those in need. So how will it work? Patients will be seen through our emergency department, where they'll be triaged, and it'll be determined if they're a good fit for the CTSC. Dr. Gomez is going to give us a little more details in terms of the process once they're transferred into the unit, but the center is directed at patients who may be experiencing anxiety, panic attacks, worsening depression. They may be at risk of self-harm or may be coping with recent trauma or loss. Or perhaps they were recently discharged from another hospital or correctional facility, or experiencing severe mood swings, psychotic symptoms, or hypomania, or perhaps are in opioid withdrawal but remain medically stable. Cook County Health is proud of the work we're doing in behavioral health space to ensure that people across Cook County who are struggling can find the type of care they need, where they need it, and when they need it. Thank you again for joining us here today. It is now my pleasure to welcome to the podium Dr. Carlos Quezada Gomez.
Good morning, everyone. It's really amazing to see all of you here. We've been working on this for years, literally. And there have been hundreds of individuals involved in getting us to where we are. President Preckwinkle talked about, the 20%, 1 in 5 individuals that experience a mental health illness. But, numbers, if the problem were a number, it'd be easy to find a solution. But it's actually people, it's souls, it's individuals, it's family members. And so with that in mind, there's been a lot of thought that was put into designing this unit the way it was. From the colors, from the furniture, the way it's being staffed, and the way we're going to introduce people into the unit. Dr. Mikaitis talked about the kind of people that are going to be coming into the program, the individuals we're going to be serving. Once they get in here, once we've determined through the ED that they're eligible for this service, they're going to come in here. Our staff are going to welcome them. They're going to then provide a psychiatric assessment. They're going to provide a physical health assessment. They're going to provide support. And if people need it, they can get a shower. They can get a little bit of food. Because we know this too. People that are going through an emotional crisis, oftentimes are exhausted, they're worn out. And if we can just start filling them up, and we start with the basic things, which is making them comfortable, relaxed, so they can actually benefit from the healing that we're going to be offering here. And the services are not going to end when people leave. Ultimately, what we're going to do is make sure that we reach out when people leave so that we know they're actually connected to services. Because here's what's going to happen. If we don't do that, we're going to see them again. And that's exactly what we're trying to change. Emergency rooms are fantastic when you have a crisis, but that's not the ideal place when you're emotionally exhausted, when you have a psychiatric crisis. So this is exactly what we're going to do here. And there's a wonderful team here led by Dr. Khan that is really going to provide that care. So thank you for being here and helping us celebrate the opening of this unit. We're really excited. We've got a lot of work to do, but we know that this is truly God's work. For people that speak in Spanish, Spanish-speaking community, I have this to say. Bienvenidos, gracias por acompañarnos. Estoy muy orgulloso de que estamos abiertos a esta unidad, que se hizo con mucho esfuerzo de muchas personas. Y estamos aquí, ustedes oyeron, la presidenta Preckwinkle nos dijo que 1 en 5 personas sufre de un trastorno psiquiátrico, de un trastorno emocional, de adicción, pero la cosa que esa es una cifra que si simplemente fuera una cifra, bueno, se puede solucionar fácilmente. Pero la realidad es que son personas, individuos, son nuestras familias. Y tenemos que hacer una cosa diferente, ¿no? Porque las salas de urgencias, cuando uno va, es bueno para una emergencia médica, digamos. Nos salvan la vida. Pero cuando uno tiene una urgencia psiquiátrica, emocional, se necesita tener un lugar diferente, que brinde el apoyo, que de veras ofrece a la persona la oportunidad de salir adelante y tener un bienestar mental y emocional que todos debemos de tener. Así que cuando la persona entra aquí, se le va inmediatamente a evaluar. Se le va a dar el apoyo, se le va a ofrecer la oportunidad de que tengan comida, si quieren tener un baño, si necesitan que alguien les ofrezca una mano, un consejo, se le va a ofrecer a todos. Y luego vamos a usar el tiempo que estén aquí para asegurar que determinemos qué es lo que necesitan y qué van a necesitar después de salir de aquí, de este lugar. Porque no termina el trabajo cuando la persona sale de aquí, de esta unidad, sino que el trabajo de veras empieza entonces. Porque tenemos que conectar a esa persona a los servicios en la comunidad. Porque si no, van a regresar otra vez a la sala de urgencia. Y queremos parar eso. Así que tenemos aquí un equipo tremendo que está bajo el liderazgo de la doctora Khan. Estamos muy orgullosos de todos y por eso, por el trabajo que han hecho y que van a hacer, les doy las gracias y a ustedes les doy las gracias por acompañarnos hoy para abrir esta unidad. Ahora, now I'm going to pass it on to Elizabeth Granado. Thank you.
Thank you. Good morning, everyone. Good morning. Thank you for joining us today to celebrate the opening of this important facility. I'm proud this morning to represent my bureau, the Bureau of Asset Management, and the team charged with the design and construction of this facility. I would like to express my gratitude to Earl Manning, Shalon Shears, Tim Ozog, and Maureen Blossfeld from the Department of Capital Planning and Policy, as well as our dedicated partners at JLL and FH Passion. Their hard work and commitment were instrumental in the success of this project. At the Department of Capital Planning and Policy, we take great pride in designing and delivering high-quality spaces that serve our community. With this project, we were given a unique opportunity to enhance Cook County Health Services by building out the Clinical Triage and Stabilization Unit to address critical needs, providing a vital step for emergent patients to receive observation and care. The project was a true collaboration between DCPP and Cook County Health. Our role in DCPP is to manage construction projects efficiently, ensuring they are completed on time, within budget, and with maximum value to taxpayers. Given the project's tight timeline, we had to act quickly to secure funding, engage contractors, and execute the build-out. At the same time, my dedicated team was simultaneously constructing another facility for Cook County Health, further demonstrating the team's incredible agility and the ability to manage complex, high-impact projects. We are proud of the participation of the women and minority-owned businesses on this project. We were able to achieve a 19.2% minority participation and 38.94% participation from women-owned businesses on this project. At Cook County, we are committed to equity in contracting and hiring. Provident Hospital has needed updated facilities, and this project represents a critical step forward in improving patient care. We are proud of our team's ability to complete this initiative with a compressed schedule, reinforcing our commitment to being partners in improving our healthcare spaces in Cook County. Our work ensures that our healthcare infrastructure aligns with the evolving needs of the community. As partners in this mission, we remain dedicated to building spaces that enhance care, improve outcomes, and serve the people of Cook County. Thank you. And with that, I'll introduce Elder Lanyard Smith.
Good morning, everyone. My name is Elder Lanyard Smith. I am a member of the Apostolic Church of God, where our pastor is Dr. Byron T. Brazier. And I act as a community engagement leader for our church in outreach as well. And I am a member of the pastoral team as a therapist. And most importantly, I'm a member of the Provident Advisory Council, where the amazing work of Marcelino Garcia goes forward. And it has been an honor and a pleasure to be a part of that team. It is a privilege and an honor to be even asked to give a few remarks about the Clinical Triage and Stabilization Center. Needless to say, this is a much needed resource in our community. Much needed resource in our community. This center is going to help a lot of people. This center is going to save a lot of lives, And as a therapist, currently working in North Lawndale on their trauma response team, I can see the things that we deal with on a regular basis. Shootings and people dealing with grief and people dealing with PTSD. All of these things are real. And what's so important, most people, they just look normal. You won't even know that people are really going through a mental health crisis. You see, this center is going to make such an impression and improve the lives of so many people here. So I look forward to the further collaboration and engagement with this unit. Thank you, President Preckwinkle, Commissioner Laurie, and all the doctors and staff here, Dr. Turner, CEO, and thank you for bringing such an important resource to my community. Okay? May God bless you all and may God keep you.
Thank you all for coming. All right, Nick, where are you? We have questions? All right, I was remiss at the beginning in not acknowledging Dr. Turner. This is his house. And Dr. Turner, we're very grateful to you. Thank you so much.